Welcome to Founders Marketing Compass. My name is Etgar Shpivak. With my experience as a co-founder and as a marketer, I'm interviewing founders and investors to learn how to build healthy, lasting relationships between startup founders and their marketing team. Today, I'm with Maya Ber Lerner, the co-founder and CEO of Cheify. Hello, Maya.
Edgar.
So first of all, thank you so much for taking out of your very busy schedule to be part in this podcast.
Thank you. Happy to be here.
So we start and happy to hear a bit about yourself and about your journey at Cheify.
Chiefly. No, I'm kidding. In the background, we talked about how our company Cheify, I'm the CEO of Chiefy. We're very often called Chiefly by accident or auto-corrected to Chiefly. Edgar, you offered that I buy the domain. I'm thinking about it. Seriously, now I can't stop thinking about it.
And to do something very cool in the creative.
Yeah, you also offered that I'm very cool and creative about it. But back to me. So my name is Maya. I'm the CEO of Cheify. And Cheify is a company for surgical team collaboration. In my background, I'm an engineer. I'm a biomedical engineer, but I spent my entire career in software, mainly building and selling tools for software developers and for DevOps. So I was dealing a lot with automation and quality improvement and collaboration when it comes to developers and testers and product teams, stuff like that. And I'm married to a surgeon. His name is Roy. And Roy had a lot of complaints about surgical team collaboration. So I had to do something about it. And when he wanted to research this topic, he got me involved in developing a prototype that he could research at NYU at the time. And it was so interesting and exciting. And I kind of got sucked into it that we somehow organically found ourselves starting a company and actually naming it after a name that was made up by the users, Cheify.
Or Cheifly, very soon.
Yes. And I'm based in New York. I have 2 daughters, married to Roy, who's still a surgeon. This is me.
So first of all, I will say that I love founders that build their startup based on the real personal pain, because it can definitely make them understand the pains and the process and the thought process of the whole buyer journey. This is like from the marketing perspective. And personally, I'm rooting for this type of founders. And we're talking here about your relationships as a founder with your marketing team, and everything eventually start with KPI. And we will start with understanding how do you, as a founders that not coming from the business or not coming from the marketing, set those KPI for your marketing team. You need to achieve this and this. This is your quota. This is what you need to gain.
A big question. My background is mainly product work. I previously worked for a startup and I did pretty much every possible job in that startup because I can't say no to anything. But most of the years were product work and sales and never marketing, by the way. I always worked with marketing, but I never did it myself. But what I did learn in product and really loved was impact mapping. I don't know if you're familiar with the concept, but it's mainly for product teams that are trying to understand why are we developing stuff, why are we doing things that we're doing. And the idea is everything that you are thinking about doing, you try to understand why you're doing it. Who is it going to impact and what's going to happen, right? So if you're changing something in one screen, who's the target population that's going to be affected by it? What is it going to make them do? And how does it connect to what you're really trying to achieve? For example, you're trying to get more users. So doing something that will make it easier to invite users makes a lot of sense, right? So back to marketing. I try to work by the same principles. So if the company has a certain goal, you need to connect everything back to that, right? If the goal is revenue, if the goal is getting to the first customers, if the goal is getting the product to readiness, then whatever marketing is doing has to somehow be tied to that. And I'm not a marketing person, but Sivan, who's an amazing person and heads our marketing, I will sit with her and I'll tell her, okay, our goal as a company is to get to this much revenue or these many customers or these targets. And then we'll sit together and you say, okay, so what can marketing do that will make an impact on that? And as a company, we're doing things that are a little bit unique in terms of going directly to clinicians, for example. So a lot of the KPIs would have to do with that.
And how did you saw those KPI evolve with the company? Like, how did you see the KPI, in your very early days versus what happening now that you gain already progress, you're already working with clients? How did you see this progress of the KPI that you set as a founder?
Well, we're still early on. We're still early stage, which means we're fast. If we're fast, then the goals of the company are changing a lot, and that means the KPIs are changing, which could be a problem, by the way, because with KPIs, one of the most interesting things about them is to look how they change with time. And if you measure different things, then you're never going to see, how it changes.
Can you
But
give
in
me an
general,
example
yeah,
of
yeah,
how, like, this was the KPI, and then we understand that we measure it wrong, and now we're working on this KPI?
So, well, first of all, the KPIs change when one of the big things as a healthcare startup, the biggest challenge is always go to market. It's never technology. Technology is like way ahead of healthcare, but the go to market is the problem, right? So this is something that we have been experimenting with a lot of different ways to get to the market. Do we need to talk to operating room leaders, for example? Are they the right audience for us, or do we need to talk to surgeons specifically and try to get to market like that? And when we tested these different strategies, obviously marketing was doing completely different things, right? In the early days. So when we said, oh, we need to get there top down, we were trying to generate top-down conversations with a different audience that marketing was trying to get, and it was a completely different number of meetings that you needed to have, and and obviously the journey was very different, so the KPIs were different. At some point, very early on, we realized that we don't want to bring Cheify to market top down initially. We want to go bottom up. And we want to go direct to clinicians, which is a very unique thing. There's not a lot of this going on in healthcare in general. And then the marketing KPI became, okay, how many clinician conversations can we have? And how do we get them? And how many of them actually can converge to a more meaningful conversation about purchasing the software that we're selling and so on. So right now, for example, our KPIs are more around the number of meetings that we manage to have, the number of conversations that we manage to have, how meaningful they are, if they lead to something, and whether we're able to converge that.
So I love this question. And you said that you come from a lot of product background. And what I've seen that in many cases, there is a real tension between this product team to the marketing team, because it's really easy for everyone for every side to blame the other one. Hey, it didn't work because you did this. No, you gave me the wrong traffic, and etc. and etc.
Yeah.
And how do you that you coming from this product background manage? You have your product team, you coming from product, you have Sivan, which is a brilliant marketer, and I'm familiar with her, and she's a genius. And every side come, hey, it's not working, because always something not working in startups. It's not working because the product didn't have the proper onboarding process. And you said in the product, no, it's not working because you target the wrong users. And it creates a real tension. How do you solve it, especially when you coming from this product background?
Somehow, in my experience, there was always great love between product and marketing. And I'm more familiar with this tension when it comes to sales versus marketing, or, well, I don't know, customer success with sales. Anyway, I think the answer is,
This is the next question. Don't worry.
okay, yeah. So I think it's the same.
This is the next question. Don't worry about it.
And it's kind of funny because Cheify, at the end of the day, is a communication company. So I think a big part of what we do is to try to get people to not work in silos. And this is the answer probably to your question, at least as far as I'm concerned. The thing is, it's very easy to blame someone when you don't talk to them a lot. And it's very easy to blame someone when you have very different agendas. And these are two things that we keep fighting. So how do we do it practically? For example, we try to and we are a remote first company, so it's not always easy, but we make sure that we meet together, marketing, sales, every week to talk about some topics on the agenda that are for all of us together. And we're looking at the goals in the company level. and how does it translate to what marketing and sales are doing to make sure that we're all on the same page. Because a big part of it, when you feel like someone is doing something and it's not what you want them to do, is because either they have a different agenda. So for example, marketing is working like crazy to get all these these leads, and sales is like, these are horrible leads, they don't lead me to anything, right? And you'll get more and more bitter about it if you give it a lot of time to fester. But if you have a conversation about it every week, and every week you say, okay, these were the leads this week, how was it? And sales says, well, we don't get much with it, and it's all the wrong people, and it's you found this and that, and it's not what we're looking for. Then you can have this conversation, you can tweak things, you can let people vent a little bit. And usually what happens is you understand everyone's really trying to work towards the same thing. So keeping it human, I think, is a big part of it.
You talk about keeping it human, and I will take you to the beginning of this conversation when we talk about KPI. You said something that I really like about I want to tie my KPI to the social impact. How many people I managed to save, how much operation time I managed to reduce, and if it's to reduce the cost of the surgery, or if this is to make the life of the patient better because the surgeon will be more focused. And you talk about amazing stuff at like the humanity level. Like this is like mind blowing. And how do you see this communication go to every like this going from let's save the humanity into hey, this is the lead, this is the character, let's do lead nurturing. Like there is a big gap because those are the same conversation that happen like in every B2B that sell optimizing the CRM or whatever. How do you manage to keep your marketing and sales focused? Hey, we're doing something big.
So we're doing something big, but we're doing it through a lot of small things. And I'm a big believer in small things. I think, for example, that when you develop software for surgeons, yeah, it needs to save lives and it needs to make surgery more efficient and care better and so on. But it's also really, really important that it saves the surgeon time, and that it gets them home to their families earlier, and that it is they need to wait less maybe for the next surgery for the room to be ready. And yeah, like it's okay to be to be selfish and to look for these things. And selfish, like quote unquote, it's the professions that we're selling to or that we're marketing to are the most unselfish that you can get, right? It's people that dedicate their lives to helping people and doing it under very, very difficult conditions. But they do deserve like better conditions. And sometimes it's very, very easy to mix that. When you start a healthcare company, it's all about saving lives and, saving healthcare. But no, it's also like getting my husband early for dinner. And it's a big part of our marketing. If you go and look, by the way, right now, like go look at the stuff that we put on social media, right? What do we do? We started a TikTok community about life in the operating room, what it means like for teams when there are miscommunication, what it feels like to drag a really heavy piece of equipment into the operating room in the morning, stuff like that. You don't think about it when you think about saving lives, but this is also part of surgery. It's getting the room ready. It's a lot of supply chain stuff and getting stuff ready and a lot of pressure. And, at the end of the day, you look at our social media, you will also see, us talking to surgeons and asking them, or telling them, you don't need to be quarterbacking your surgeries. You don't need to be spending hours on sending emails and text messages and making sure that everyone is ready. Everyone knows what you're planning. Everyone, just so that you can come to the room and be kind of relaxed, that your patient is in good care, and that the room's going to be set up just right and everything's okay. Like you don't need to quarterback it. Someone is going to help you do it, and this someone's our software. But it's a lot of very small things, right? It's not all about let's save surgery together. It's more about let's use 2024 technology toolbox to make your day in the operating room much better and let you focus on the stuff that you wanted to focus on when you went to medical school, for example.
I like it so much. It's really, really hard to explain how much I love this train of thought. And personally, I believe that in the long run, it also saves life, because if someone is focused and is happy on his work, he will do a better job for the long run.
Yeah,
So,
completely agree.
going about hiring and compensation question. First of all, when you look to hire your marketing leadership, what are the top three qualities that you look for when you make this hiring?
Well, usually we find ourselves hiring people when we definitely don't need people and cannot afford them, but we fall in love with them and we just say, okay, this person cannot be joining our team. I see that it's kind of a repetitive behavior for us, and I think I kind of like it. But in general, when we are talking to people, and I think that the reasons that make us fall in love, first of all, as a communication, as a teamwork company, a lot of it is about team players and people that can complement the team. And I kind of feel like as the team grows, but every every team member that's added, it kind of makes it better and nicer. It's like this core that's growing, and everyone adds like this nice thing that's added to it, and it becomes like this stronger entity. I love that. So being a team player is a big part of it. I really can't say no, I think, to people who are kind of like have these expanding personalities, like they want to take over everything. They started from, helping you with the website, and suddenly you find them doing your lead generation, your growth marketing, and your it's my favorite thing in the world is expanders, and people that just can't stop.
I just love it. I know a few people like this, and they're definitely a treasure for every company.
Yeah, so I love treasures.
And talking about hiring, one of the big debates is about how do you structure the compensation for your marketing team, because especially in early stage, when even the sales team is still building, and we're not quite sure what is the revenue for each lead. And in the other hand, we do want to make a connection between the performance part to the overall compensation. How do you see this as the one that need to make the reports to the board and to the company stakeholders?
I'm going to give you a not fun answer. It depends, right? Every function, and the question of how much this function really needs to be incentivized by stuff, or is it very easy to understand? For them to know what to do and for them to develop the habits to do this job well. And it depends a lot on the person also, I think. And in marketing, for sure, some things are, I'm not always a big believer in telling someone, hey, make this list of 1,000 people who said they were interested into 100 meetings, or like whatever. But sometimes you need to do it, right? And it's something that makes sense. So I don't have one answer. At least at the early stages of the company, I think the most important thing is just be flexible about it, and to understand that when you put incentives on stuff, you generate behaviors. So it's very important to understand what behaviors you're generating, and if you're generating the wrong behaviors, kind of change that. And
This is
we've been
definitely the hard part, and especially in marketing, when the sales side is not 100%. This is like one of the struggles that I see marketers who go to work for early stage, and founders and investors struggle with, like, it's not really clear how to build those structures. Going from your experience in Cheify and in Chiefly and in other companies, what is the one mistake that founders commonly make when they're working with their marketing team?
if you're talking about mistakes, there can't only be one, probably.
I know, I'm talking about, if you want to put the finger on one that you see with your colleagues, that with what you hear that is commonly being done, or something painful that you had while managing this department.
I think the one thing we keep going back to is making sure that marketing stays with the right focus on what the company is trying to achieve, because there's so much that can be done. And sometimes you want to do things in marketing and they don't have very clear results for the company. And then it becomes like this, things like brand awareness, right? How does it translate to what does it help me that 10,643 people went to the website? I want to know, how many meetings it generates. But no, like we need to have these 10,641 entries to the website because, you'll thank me later kind of thing. And these are conversations that I know, obviously Sivan and I have all the time, right? Whenever we sit and do something, it always gets to, wait, why are we doing this? What is it going to do? What are we trying to achieve? And, I'm very lucky because Sivan likes to put KPIs on everything and measure everything and go back to everything. And it's like her nature. So I'm spoiled, I don't need to always be the big thinker about this. So the answer is the biggest mistake is not to find heads of marketing that are super amazing. That's it.
So, first of all, I really, really enjoyed this conversation on marketing. And now for the last three questions, they're talking more about you as a founder. And what is a common misconception about running a startup that you would like to debunk?
Misconceptions. When I just started Cheify and I was talking to a lot of people, there was one founder that told me that the biggest problem with startups is not failing or, not the question is if you're going to fail or succeed, but if you're not going to know, like this gray area of you're not really succeeding, but you're not really failing. And I think that the biggest misconception that I can think of about startups is when you started and you're like, okay, if it succeeds, it succeeds. If it fails, it fails. And I think society is a little bit in love with failing. And you're like, yeah, I didn't, I didn't fail. I just found 10,000 ways that don't work. All this, people are a little bit in love with failing and the idea of failing. But the idea of not really, of just keeping going and spending like 5 years of your life doing something that hasn't really succeeded amazingly, but hasn't really failed, is a bigger thing that I think you need to kind of think about when you start something. You're going to do it, and if you're persistent, if you're talented, and then maybe what you're going to do is not going to completely fail. Maybe it's not going to completely succeed, and you're just going to keep doing it for a while, and you want to do it, right? Even if it doesn't become this incredible, unbelievable, top 1% story, but also you don't get to get your failed satisfaction of, oh yeah, I tried it for 6 months, but it failed.
And what would it be if you could give yourself one piece of advice on the day that you launch your startup?
On the day that I launch my startup, probably will tell myself just to, that in healthcare, it's all about go to market. Nothing else matters. It's like the only thing that it's going to succeed or fail.
As a marketer, I can say that in other fields, it's all about the go to market, but I'm definitely biased.
Yeah, I come from DevOps. I mean, I've seen products that were successful just because some product got launched and people started using it, and 5 years later you had this crazy community, like all these Cinderella stories, and I still have that. I carry that in healthcare and in a lot of other industries, and maybe all industries. Yes, go to market. Just go to market. So that's the one thing that you need to figure out, I think. I would definitely tell myself that, and I would not listen and do the same things because I'm stubborn.
And for the last question in this very fun episode that I'm really enjoying here is, which question did I need to ask, but I didn't?
I'm enjoying it too, Edgar. But I think you asked everything. I don't know. I can't think of anything that you haven't asked, really.
Maya, thank you so much. I really enjoyed this episode.
Likewise.